Hello, good day, my dear friends. Today we are back to discuss about a very important topic called as Kawasaki disease. Now, if anyone hears this term as Kawasaki disease, they feel quite strange. We have not heard about this sort of a diagnosis ever. I faced this situation with some of my patients earlier in this week. So I thought I should enlighten all of you regarding this disease, which is called as Kawasaki disease. This is an difficult to diagnose and difficult to treat scenario. This is basically an immunological disorder. What I mean to say is it's an inflammatory disorder. Usually, Kawasaki disease affects children under 5 years of age, but sometimes we come across patients as big as 8 to 10-year old also. The uniqueness of this disease is it causes dilatation and swelling of the arteries, which in medical terms is called as vasculitis. This has to be treated very quickly and promptly so as to avoid the complications coming out of this. Mainly the complications of the coronary arteries or the blood vessels that supply the heart. This topic will be divided into 10 headings. Firstly, what are the symptoms of Kawasaki disease? What is the cause of Kawasaki disease? How is it diagnosed? What are its complications? A small note on coronary artery aneurysm, followed by discussion about its treatment. And many of the scenarios I come across is when the patients ask me, when would my child become better? What are the follow-up protocols after discharge? Will the child get Kawasaki disease again? And when will the child go into normal school and sports activity? So, my dear friends, let's not waste time and jump ahead into this discussion on Kawasaki disease. Now let's discuss about the symptoms of Kawasaki disease. So usually it begins with fever, which is for more than 5 days. It lasts longer and is sometimes associated with other symptoms like high persistent fevers, cracked lips, swollen tongue, strawberry-like beefy looking tongue, development of rash all over the body, swollen fingers and toes, and sometimes we come across the lymph nodes on the neck which are swollen, and bloodshot eyes or red eyes or conjunctivitis like looking eyes. Doctors sometimes refer to some of these conditions as incomplete Kawasaki or atypical Kawasaki. This is when all the symptoms are not present, but only some of the symptoms are present. Not all symptoms are present on any given particular day. So we may coin the term as incomplete Kawasaki disease or atypical Kawasaki disease. Please don't panic by hearing this term, but the treatment would be same. Sometimes it is also associated with other features like loss of appetite, lethargy, weakness, stomach pain, loose motions, etc. Usually from 14th to 21st day after the Kawasaki disease onset, we see peeling of the skin on the hands and legs. And some of our friends look into this particular aspect in the beginning of the disease, whereas peeling of the skin occurs late in the disease, and it is usually a symptom of recovery. Now, many of you might be wondering what causes this Kawasaki disease. Scientists and researchers were not able to pinpoint the root cause of Kawasaki disease. But hypothetically, there are two theories that rule around the cause of Kawasaki disease. The first thing is genetic predisposition of an individual or tendency of a child to develop Kawasaki disease, which is genetically determined. Second is an immune mediated inflammatory disorder or immune mediated change in the body's structure and immune system, wherein our body's immune system produces inflammatory cells that will damage our own tissues. It is called as autoimmune disorder. This particular autoimmune mechanism is usually triggered by some viral or bacterial infections which do occur within 2 to 8 weeks prior to the onset of Kawasaki disease. So overall, as such, we don't have a root cause of this problem, but researchers think that There could be a genetic tendency of an individual to develop Kawasaki disease, or some viruses may alter our immune responses and make our body more inflammatory, damaging our own tissues. Now, let's discuss about coronary arteries and their dilatation and aneurysms. What is a coronary artery? Coronary arteries are those important blood vessels that supply blood, oxygen, and nutrition to the muscles of the heart. So, heart is definitely a muscle and it also requires nutrition, oxygen for its constant pumping. In fact, it requires a very high volume of blood and also lot of oxygen and nutrition for its continuous pumping starting from the day we are born. Now, what is dilatation? So, swelling of the coronary arteries is called as dilatation. And when the dilatation exceeds by a certain amount, it is called as an aneurysm. So, dilatation and aneurysm are the hallmarks of diagnosis of Kawasaki disease. Usually, whenever we suspect Kawasaki disease, as per my previous discussion regarding the symptoms, the laboratory investigation that we order is a 2D echo. In 2D echo, the cardiologist, the pediatric cardiologist, usually looks into the coronary arteries and measures their dilatation. This is something which we call as Z scoring. Z score is nothing but it is the dilatation of the coronary artery with reference to the age and weight of the child. Because a small child can have a narrow artery and a big child can have a big artery. So a big artery doesn't mean it is dilated and having an aneurysm, right? So in this particular context, considering the age and weight of the child, Z score is done to determine whether the coronary artery is dilated or not, or whether any aneurysms are present or not. This definitely is a hallmark diagnosis to find out whether the child is suffering with Kawasaki disease or not. How do we make a diagnosis of Kawasaki disease? Usually, Kawasaki disease is not diagnosed by any particular single blood test or any other imaging. It is a mix of both clinical signs and laboratory parameters. And essentially, not all the symptoms should be present at any given particular point of time. So, a combination of symptoms plus laboratory parameters is usually taken into consideration to diagnose Kawasaki disease. What are the clinical symptoms? As I have discussed with you earlier, raise in fever for more than 5 to 7 days, strawberry tongue, red eyes, lymph nodes on the neck, and development of rashes are the hallmark clinical symptoms that usually the child comes to us. And in the laboratory parameters, the most important thing is the 2D echo, which I have discussed with you earlier, which can show a coronary artery dilatation or aneurysm, along with sometimes we may come across rise in platelets, rise in the total WBC or white blood cell counts, and most importantly, rise in ESR. So, not all the symptoms should be present as a criteria to diagnose Kawasaki disease. Sometimes we come across those children who are having all the clinical symptoms but not having any rise in platelets or WBC, and 2D echo shows only mild dilatation. In these scenarios, we brand them as atypical Kawasaki disease and the treatment will be the same. The next section deals with complications. Many parents of the patients ask me, are there any complications with this Kawasaki disease? This is, in fact, the most important worry of all the patients. So, as you know that this is a damage to the blood vessels, especially those supplying the heart, definitely it has to be worried. Usually, in my experience, what I recall is for those patients who have mild dilatation and on proper therapy, they usually recover within 2 to 4 weeks. Repeat scans are usually advised at 2, 4, 6, and 8 weeks. And once after 8 weeks, the scan comes back to normal, no need to be worried about it. And for those children who are diagnosed with coronary artery aneurysm or a big dilatation, wherein it requires a long-term therapy usually lasting for about 3 months. Later on, when the scans become normal and there are no symptoms, they can usually lead a normal life. But total remission of the disease usually occurs up to a maximum of 2 years. But in my experience, I have not seen anybody coming back with a repeat attack of Kawasaki disease. The next section deals with the treatment of Kawasaki disease, which is a very important for all of you to know about it. Initiation of early treatment reduces the risk of heart damage and complications. So it is imperative on our part to diagnose it fast and start the treatment fast. The mainstay of treatment is to switch off the inflammation that is produced by the body's own immune mechanism. Then what are the medications that are usually used for this purpose? The main drugs are two. One is the intravenous immune globulin and the second is aspirin. So the main treatment for Kawasaki disease is a combination of intravenous immune globulin and aspirin. Let's talk about intravenous immunoglobulin first. It is nothing but this immune globulin is prepared from the human plasma itself, donated human plasma, which is rich in antibodies. These are the same cells that fight off infection and inflammation. This is a generally safe medication, and intravenous immune globulin is known to boost our immunity and fight against the inflammation and in infections also. Sometimes a second dose of IVIG may be required in a small fraction of children who will not respond to the first dose. Usually, this is tolerated well with very minimal side effects. The second drug which I want to discuss is aspirin. Aspirin is useful to switch off the inflammation. Here, aspirin is given as 2 doses. In the initial phase where we require anti-inflammatory effect, there we give around 50 to 70 milligram per kilogram divided into 4 doses in a day. And then once the fever settles and other symptoms settle, we downregulate the dose to 3 to 5 mg per kg per day, which is otherwise called as a maintenance dose, and that is given for over a period of 6 to 8 weeks till the 2D echo scan comes back to normal. The only side effect of aspirin is gastric upset, acidity and gas, for which antacids should be given to prevent these complications. There are other modalities of treatment also that are usually used, and the most important thing, if at all IVIG and aspirin doesn't seem to be working, is corticosteroids. Sometimes doctors do refer to this term corticosteroids as steroids. Please don't get carried away by the word steroid, as it is not the same drug that is misused by athletes and bodybuilders, and those have a lot of side effects. These corticosteroids have a much safer profile and can be used in children very safely. They have shown to be very effective in the treatment of children with a lot of inflammatory disorders. Finally, the newer modality of treatment is another new group of anti-inflammatory drug which is called as infliximab, which is a TNF alpha blocker. This is a very new modality of treatment wherein IVIG, aspirin and steroids, they don't seem to be working. So finally we can start off with infliximab, which is given as a one-off dose. Once the treatment is started, the most commonly asked question by the parents is, how long will it take for my child to become better? Usually, for a complete recovery, it might take around 2 to 4 weeks, but hospitalization will be for on an average 5 to 7 days based upon my previous experiences. This is usually required until the inflammation has stopped, there is no fever, there is no skin rash, and the lymph nodes subside and even the eyes become normal. Usually, it depends upon how they respond to the treatment. And after 2 to 3 weeks, parents also notice peeling off the skin from the toes and thumbs. So this is not to be worried because this is a sign of recovery. On an average, for the child to become normal and go back to normal school and sports activities, it will take around 2 to 3 weeks, but a total recovery can be expected. That is, returning of the 2D echo back to normal can be expected by around 6 to 8 weeks if it is an uncomplicated Kawasaki disease. What is the post-discharge follow-up advice that we usually give to the patients? Usually after discharge, we ask them for every 2 weekly 2D echoes so that the inflammation of the coronary arteries can be assessed, and it will also guide us when to stop the medication. Usually large dilatation and aneurysms may require a long-term low-dose aspirin therapy, but a minor dilatation can heal fast, and we can also stop aspirin by the end of 6 to 8 weeks. No discussion on Kawasaki disease is complete without telling you the last two questions. Will the child get Kawasaki disease again? And when can they go back to their normal school activities, and about their vaccination status? Usually, 1 in every 100 children get a relapse or reoccurrence of Kawasaki disease. But in my experience in the past 24 years of pediatrics, I have never seen any child coming back with recurrence of Kawasaki disease. Some children can experience milder variation of Kawasaki disease. So we usually instruct the parents, whenever there is a fever of more than 5 to 7 days, immediately approach a pediatrician and also pediatric cardiologist for a complete evaluation of Kawasaki. It is essential for the parents to tell the primary care pediatrician that the child has had Kawasaki disease before. And when can the child go back to their normal school activity? Usually by the end of second to third week, when the symptoms are completely gone, they can go back to their normal school and sports activities. But please take care to vaccinate the child completely. Live vaccines should be usually avoided till about 2 to 3 months after giving IVIG. But inactivated vaccines can safely be given. So my dear friends, all the very best. Hope this information will be useful to you. If you like my videos, for more informative medical content, please put a like to my video and subscribe to my channel. Thank you.